Joining me via Skype is public health specialist Dr. Nseh-Abasi Ekandem. Good morning, and thank you for joining us on TVC Breakfast.
Good morning.
I'm certain that you listened to the president's speech talking about easing lockdown measures. But at this point, considering the rise in the number of infections, are we at that point where we can begin to ease restrictions?
Honestly, in my own opinion, I would say that the easing of the lockdown is actually premature. It's only unfortunate that it had to be done, I feel, because of the sufferings of Nigerians, the economic lockdown of activities. That is the lockdown of the economic activity, which has affected a number of Nigerians negatively. But besides that, I think that we should have at least waited a bit longer, because in the past 1 week we've seen a number of an increase in the number of cases that have been detected, and that's a positive note. I feel that it's the best opportunity for us to keep all Nigerians at home so that more testing can be done. I said some time ago that when we increase our testing capacities, we are going to see more cases. And once we are able to achieve that, then we can be able to, find these cases and have them treated so that community transmission will be curtailed. At this time, when we are detecting more cases, I felt that it's not really the best time to lift up this lockdown. Rather, it is the time to tell Nigerians to keep staying at home so that we can, consolidate on the achievement recorded so far.
Talking about increasing our capacity for testing, the NCDC is looking at 2 million tests in 3 months. With the level of spread and the population, is this an ideal situation, or if we are to look at it critically, how ideal is this? 2 million tests in 3 months?
Well, I just hope that we can achieve that, honestly, because if you look at what we have achieved in the past, say a month or two, we have barely tested up to 20,000 persons, and then 20,000 samples. I don't know how we are going to achieve that, but like the Director General said, if we can be able to bring in all states to increase testing, now we have more laboratories across the country. I think what we should do now is to ensure that all state disease control units send as much samples as possible to the reference laboratories. And if with the new technique that we're using now, the turnaround period is shorter, and hence we can be able to achieve that. If we can achieve 2 million tests in 3 months, I can tell you that that is a very good fit for Nigeria as a country.
All right, now that the government is looking at easing the lockdowns, what would you expect the NCDC to do at this point, the approach towards testing, contact tracing, and the likes?
Well, I think the first thing that has been recommended is a fantastic idea. First of all, all Nigerians must learn to use a nose mask. That will help to an extent to reduce community transmission. But for NCDC, I think the work is now, the responsibility now lies on them. First of all, to replicate what is happening in Lagos, to ensure that easy access to testing is achieved. We should have more testing centers in every state so that samples can easily be taken to the centers and then results can be released on time. Again, in terms of contact tracing, I think at this point we need to strengthen our epidemiological strength to ensure that we are able to trace contact and ensure that people who have been confirmed with COVID-19 are properly isolated, and all contacts are traced and isolated or tested through, so that we can be able to contain the virus. It might be difficult when the lockdown has been lifted, but I think that with innovative strategies, we can still be able to achieve something commendable.
All right, Dr. Nseh-Abasi Ekandem, thank you for speaking with us.